Hello, welcome. Today I will discuss with you the major first aid techniques which are used during any emergency to provide the first aid for the casualty. Any skilled first aider can save the lives by maintaining the vital need of the casualty, which are known as the AVC techniques. By A we mean that we have to open the airway of the casualty, and by we mean that we have to quickly provide adequate breathing for the casualty, and C mean that casualty continue to his circulation, mean blood circulation. As we know that for life to be continue, a person must be able to take oxygen into the lungs, and this in turn be distributed throughout the body. While it is possible for the some time that body may be continue to survive without oxygen, some some organ are very quickly affected. Nerve cells in the brain can die after only 3 minutes. Therefore, please keep in mind that for as the as any casualty occur, supply of the oxygen to the casualty body is very important. The three emergency situation where a casualty is especially at risk because of the interference with the vital need are lack of the breathing, heavy bleeding, state of the unconsciousness which it develops is likely to interfere with the open airway and breathing. Therefore, I am giving to the some idea about the how to open the airway, adequate breathing, and how to continue the sufficient circulation. How to open the airway? The airway may be blocked in an casualty due to loss of the cuff that allow the tongue to sag back and block the airway. Also, foreign bodies like solid food particle or some type of the dentures may also block the airway, and all these cause the casualty difficult for breathing and nausea. An airway is cleared by number one, Use your index finger to hook out any material in the mouth, such as broken teeth, vomit, broken dentures. Number 2, remove any anything like scarf, cloths, any obstacle around the neck. Number 3, hyper extend the neck by placing one hand under the neck and other hand on forehead to tilt the head back. Lift the chin forward. That pull the tongue forward and open the airway. You can also practice to help the casualty by keeping the casualty in the recovery position. This I am showing you the exact position for for laying down the casualty in the recovery position. This position is called the recovery position, and this recovery position help the casualty to open airway, so preventing unconsciousness of the casualty. As for breathing is concerned, that how to give breathing, artificial ventilation is the method to get air into the lungs of the casualty who has stopped breathing. Again, I am mentioning here that don't forget to give all these things very quickly. For restoring the breathing, after the airway is cleared, listen for the 5 seconds with your ear close to the victim nose and mouth. If breathing has been re-established, mean that you are you have firstly opened the airway, then listen for the 5 seconds. That is the casualty taking breathing. If not breathing, quickly perform mouth to mouth breathing by the following techniques, which is pinch and compress nose close to mouth. Take a deep breath. Place your mouth over the victim mouth, making an airtight seal. Breathe into victim mouth 4 times quickly, taking quick breath in between to refill your own lungs with fresh air. Allow patient to exhale passively by elastic recoil of the chest between two breaths. I am telling here you that we have to give the breathing by mouth mouth to mouth ventilation. Later on, I will explain you deeply about the other breathing techniques. Now let us discuss about that how to start the circulation. External chest compression may be applied on the chest as I am showing you in the picture to compress the heart and so pump blood throughout the artery to the vital organ. This technique also requires some mastering, and later on I will show you that how to um, start the circulation. At this stage you simply learn the position, that how we can start the circulation of the casualty. At the end, how to control severe bleeding. Controlling severe bleeding to prevent or minimize serious blood loss is also one of the technique, so that a casualty circulation can be maintained. Therefore, in this lecture, I am simply giving you the first aid techniques which are used during the emergency. At the last, I told you that control of the severe bleeding. It is important to practice this technique under trained supervision, as no indirect lecture is substitute for practical knowledge and experience. Because you must know the body functions and the circulation, so that you can apply the special techniques. But don't worry, in later on lecture, when I will discuss one by one all these techniques and other method, I will try to give you the full demonstration. Thanks, and hope that you continue you will continue to listen my lecture in future and give me my feedback. Thanks.